Let's talk on the programme to Dr. Layla McCay, Director of the NHS Confederation. Good morning.
Good morning.
So we've just done this. I live in NW8, that's northwest London, and was told I'd have to go to Newport in the Isle of Wight to have a drive-through coronavirus test. Well, obviously I'm not going to do that. I'm not going to Southampton and getting on a ferry to get a test for coronavirus. But what has gone on there? What's happened?
It's all very odd. I mean, what we're hearing, of course, is that this is because there are spikes in other areas, but we're also hearing that there is more capacity for testing than is being used. So these reports are very concerning. I think that we've known all along that testing is part of the bedrock of our coronavirus prevention strategy. And if people are not able to access tests near their house, then that's really going to be a disincentive to trying at all. So my concern when I hear about this, which I strongly hope is a very temporary situation, my concern is that people will be put off going for a test at all, and that would be a great loss in the attempt to prevent the transmission of coronavirus.
On the other hand, the home testing kit remains available. I think many people would find that more convenient, more popular anyway, because you don't have to leave your house and you don't have to possibly see anybody else and you don't have to wait in the car park and all of this. Do you know of people who've used the home testing kit, and do you know what the procedure is and how reliable it is and whether it's a good option?
The home testing kit has been found to be reliable. It is a good option. As you say, when you're feeling unwell and when you're potentially infectious, you don't really want to be moving around, for example, on public transport or encountering other people when that can be avoided. So particularly for people who don't drive and who don't have an easy access drive-in centre, then the home testing kit is clearly a very positive option. I think the one challenge with home testing kits is that, of course, you have to post them and wait for the results, so it can take a bit longer for those results to come back. So when part of the strategy for preventing coronavirus transmission is the test and trace as quickly as possible after you get the result, you really want a speedy result.
What is the advice for people who want to test because they think they have some kind of symptoms? I mean, it says on the computer, I've just done it, what are your symptoms? What do you feel? What is your reason for wanting the test? Now, it might be, I feel absolutely fine, but I just want to go and meet an elderly relative and I want to make absolutely sure I feel absolutely fine, but I just want to go on holiday or something like that. But it might be I've got a cough or I've got a fever or whatever it is. When you have those symptoms, if you have those symptoms, and you've sent off for the home testing kit, let's say, because you don't want to go to the Isle of Wight for a drive-through test, are you supposed to stay at home from that moment, from the moment you experience the symptoms, as if there was a positive test result, waiting? Or what are you meant to do during the interim as you wait?
The most sensible thing when you're having symptoms that could be coronavirus is to keep yourself separate from other people so that you don't risk spreading those symptoms and spreading coronavirus. Whether or not you have actually got the coronavirus, it's very helpful to know that so that you know what particular steps to take so that the test and trace system can be used to find all your contacts. But certainly if you have symptoms, the sensible thing would be to avoid spreading them.
Right. And so if you send off the home testing kit, it arrives at your house, what do you actually have to do? Do you have to stick a swab down your throat or something? What does it involve?
Well, I have not personally done the home testing kit, thankfully. I've been fortunate not to have had any symptoms, but the description of how to do it is apparently very clear and easily executed by yourself in the home is what we've been hearing. It's not a complicated procedure. It does. Some people do tell us there's quite a lot of instructions and various bits and pieces have to be put together. Yeah. But in general, the people that I have spoken to have said that they've been able to do that without a significant problem.
Should people worry about the scaling back of drive-through test opportunities in London? When the children are going back to school this week, people are being urged very strongly by the government to go back into the workplace. People are flying back from whichever holidays they've been on and might have contracted it on the beach or on the plane on the way home. In other words, it's being suggested, let's hope it's not true, that there might be an autumn spike imminently. Therefore, should we be very worried that the sort of opportunity to be tested has been scaled down, it seems, just to coincide with that moment?
As I say, I very much hope that this is a temporary situation, because if it's not, it is worrying. We know that it only takes a few cases to suddenly have an outbreak in an area, and part of the purpose of the testing programme is to be able to identify these potential outbreaks and nip them in the bud before they start to spread. If there's not easily available testing, people may feel slightly less tempted to go to the bother of getting a test, and we don't have that information. We're not able to nip that in the bud. So from that perspective, I think that the message that I would say is if at first a test is not available, try again, because really this is a public service to make sure that if you happen to have the virus, you know about it, people can be contacted, and it's stopped before it's transmitted further.
Final question. As autumn and winter approach, people are more likely to get their usual array of coughs, colds, sniffles, temperatures that last 24 hours, a bit of shivers and shakes, and then you feel better the next day, that kind of a thing. All through the summer, whenever anyone coughed or sneezed, it seemed to me they immediately said, it's hay fever, so that everybody around them would kind of think, oh, okay, all right, okay, it's definitely not coronavirus. Why is that person coughing, sneezing? Hay fever, it's allergies. But as autumn approaches, we're accustomed to people coughing away and sneezing and everything else, aren't we? So what should people do if they have a cough and it is new, but they feel it's their usual autumn cough? They always get it, or a cold they normally get, something like that. What should they do?
Well, at the end of the day, if you have symptoms that are on the recognised list of symptoms that could be coronavirus, and you think there's a possibility, then it's a really sensible thing to do to go and get that test. I mean, it could just be some normal cold, but if there's the particular symptoms of coronavirus, which are all listed on the website, as you'll have seen when you went through the testing thing this morning, then yeah, absolutely. The government is really focused on increasing the amount of testing available, because we recognise that. On the other hand, if everybody is doing a really good job of social distancing, hopefully there will be fewer sniffles over the winter, because we'll actually have less chance to catch them from each other. Of course, it's not exactly the same, but there could, of course, be a reduction, which would be great.
Excellent point. Thank you very much indeed. That's Dr. Layla McCay, their Director of NHS Confederation.